Hello, I'm Dr. Ted Truitt, and you're watching this video probably because you're thinking about having sinus surgery, or you had it and you just kind of want to know what to expect. The surgery that you're thinking about having is one where we try to ventilate the sinuses better by removing some tissue from those openings, and that helps treat sinus infections and helps patients breathe better and just makes the nose overall work better. This is a surgery that's usually done under general anesthesia. That means you're put totally to sleep. We look with a endoscope, and we can go around to the sinus openings and remove some of the tissue from there, and that allows air to get into the sinuses and for mucus or whatever's in the sinus to get out, and so it just helps the sinuses go back to normal. The procedure takes about a half an hour to an hour to do. You go into the recovery area afterwards, and shortly after that, you're back with your family. It takes about an hour from that point, and then you head home. There's a little bit of bleeding after the surgery. It's normal to go home with some bleeding. We put a gauze under the nose to help with that. You just kind of keep an eye on that gauze, and if it totally fills up with blood, just put a new one on there. If we wanted to prevent any blood from coming out after surgery, we'd put packing in there, but packing is relatively uncomfortable, so we try to stay away from that. That first night, you might change your gauze about 4 to 5 times, and that's normal if it fills up with blood that much. It's more comfortable to be sitting up during your first night. The pain during that first night it's not too bad, but you'll have some pain medication to go home with. Usually we have you stay off of blood thinning type pain medications like ibuprofen for the first night. You might get some directions from your doctor about when you can start a medication like that. Those medications really do help a lot, and it'd be nice to get you off of the narcotic type pain meds fairly early on because of the side effects that are undesirable with that. You'll have some specific instructions about when to start what nasal spray, and there's a sinus rinse that you'll have to do afterwards. It's essential to good healing after surgery. You'll have some instructions about when to do those. Usually it would be, on day 1, day 2, or day 3 when you start doing those twice a day. It's just important to get all the clots and some of the dissolvable material that we put up there out so that you can heal a little bit quicker. When you're done with surgery and it's 2-3 days afterwards, you may think that you're no better, or you're actually kind of worse than where you were before surgery. It's normal at that point to still feel like you're clogged up, that you're having some facial pressure, and it may take any time from 2 to even up to 6 weeks to really feel the benefit of the surgery. So you kind of have to go through a period of healing where things are a little bit swollen and you have stuff that has to get out of your sinuses to start feeling normal. So those rinses that you're going to be doing are very important. And if you don't either get the stuff out of there, which would be blood clots and that material that breaks up over time, if you don't get that out early enough, when you come see us, we may have to get that out in the office. So what to expect when you reach your follow-up appointment is we're going to look up there with a scope and clean out any material that's still lingering in that area, which might involve some suctioning. So hopefully you've done your job with the rinses and have cleared it all out so that we can so there's not really much for us to do when you come back and see us. There's another part of this surgery that may or may not happen to you, and that is getting your deviated septum fixed. We don't have to fix your deviated septum if it's not causing a problem or won't allow us to get up to the sinuses. So if it's getting in the way, your septum, we might need to fix that. That's done through a little incision inside your nose. There's no incisions on the outside of your nose. We take out the bone and cartilage that's keeping it off to the side, and then once that's out, we have some dissolvable sutures that are in there, and we will usually put in splints in the nose. Those are thin pieces of plastic that are on each side of your septum. They take up some space in your nose so you don't breathe as well while those splints are in. It's important to use saline spray, which your nurse will talk to you about before you go home, and that will keep the crusting from also blocking your nose that's touching up against your splint. Those splints stay in about 5 to 8 days. You come in here, we snip a little suture and slide them out of your nose. It's not that painful of a procedure. It might be a little bit sore, but patients tolerate it well. The breathing will be so much better after your splints are out. So don't get discouraged during that first week if you're having a lot of pressure and can't breathe well, if you know you have splints in there. The nose usually is working a lot better after that point, and you're able to get your rinses up there better. If you don't have splints in, the rinses can get up there a lot sooner than that first week. It's the procedure overall is a easy procedure, and will give you a lot of benefit, and you shouldn't worry about this procedure. It'll be great.